Meantime, we'll just
Good evening, everyone, and a very warm welcome to all of you as we wait for more of our colleagues to join in. Kindly type in where you're joining us from. It's rather rainy here in the city. Good evening, Sibuoga from Wajir. I'm not sure whether there is rain in Wajir. The team from Nairobi, karibuni sana, Kasim, Peter, Dr. Punam from Thika. Good evening from Kericho. We have Liwen Chepngetich, Dr. Rabera, karibu sana from Nairobi. I see also down at the coast in Mombasa, Dr. Gola says it's been raining since morning. Karibu sana, Dr. Amadalo from Vihiga, was from Nakuru. Thank you all for joining on time, embracing this weather. Karibu sana, Wara from Nakuru. We'll give more of our colleagues like 3 more minutes and then we shall begin. Karibu Machio from Kisumu, Geraldine from Machakos, Karibu Dr. Joseph from Nairobi. Also, maybe as we wait, could either of you maybe comment on your expectation from this session? Sana, Dr. Ateka from Taita Taveta, Dr. Anthony from Thika, Dr. Kennedy from Siaya, karibu sana. Alfred from Nairobi. Karibu Dennis from Bungoma. On behalf of the Pharmaceutical Society of Kenya, I am delighted to welcome all of you to this CPD accredited webinar in partnership with Bayer, titled From Counters to Counseling, Navigating Modern Contraceptives. This session is part of our ongoing effort to strengthen the pharmacist's capacity in reproductive health and family planning, which is a critical part of modern pharmacy practice. Presenter will be Dr. Michael Mungoma, who is the current Dean the School of Pharmacy at Mount Kenya and an expert consultant in family planning. And just as we wait for the clock to hit the 5th minute, karibu once again, Wango from Chogoria and Tabitha from Kirinyaga. Welcome all, karibuni sana. A few ground rules. You will be muted during the entire course of this session. I would like to encourage each and every one of us to engage through the Q&A tab in case you have any questions. It's at the bottom of your window. Try to channel all the questions on the Q&A tab rather than the chat function. And also kindly note that this session is recorded and available on our YouTube page. If you would like to refer back in future, you can visit our YouTube page. And also you are reminded to subscribe to the events on the PPT portal. This ensures timely disbursement of CPD points. Hopefully, the event is not yet approved by the board, but it will notify you once it's up the portal. This is our agenda for today. Even as we have more people joining in, and as the ground rules sink in, remember our topic is on from counters to counseling, navigating modern contraceptives. I'd like to invite all of you to partake on our test. It will be on your screen in a moment. Just confirm. Can see. Um, there should be a poll on your screen. We'll take a few minutes to go through this. Question one, there are very easy questions just to refresh your memory. I would like to encourage each of us to try and participate in these poll questions. Which contraceptive method can trained pharmacists in Kenya legally administer under MOH guidelines? Do you know the answer? Anyone? I see the answers are streaming in. Keep them coming along. Number two, which of the following best defines self-care in contraception? What do you think is the right answer? Which counseling skills enhances clients' understanding and trust during contraceptive counseling? The answers come in. We have question four. Which statement best describes the mechanism of action of estradiol valerate diinogest combination in contraception? Do you pharmacology. In women with heavy menstrual bleeding without organic pathology, what is a key therapeutic benefit of Dynogest, a combination pill? Thank you to all those who are participating in our poll. If you've not, it should be up on your screen. The last question is patients would benefit most from an estradiol valerate Dynogest combination. Answers coming. I'd love to encourage you, Chani. Let's interact with our poll. Isinya from Mombasa. Rohan from Nairobi. Have you answered the poll? Dr. Moses Mwaniki. Dr. David Esabwa. Keep the answers coming. Which contraceptive method can trained pharmacists legally administer? I can confirm it's not a trick question. Kevin Mukuru. Kindly interact with our poll. If it's on the screen for a moment. Do the final touches. We have 1 more minute. For those of you who are yet to respond, Moses, you're unable to see the poll. I'm not sure whether you're on your phone or computer. Just final touches. For those who not see the poll, I'm sharing a QR code, and we'll give you 1 minute. Just screenshot scan through. Okay, I hope those who are not able to see the pop-up can scan the QR code. Meanwhile, just a reminder that our speaker today is Dr. Michael Mungoma, current Dean School of Pharmacy, Mount Kenya University. Dr. Mungoma, maybe you can share yourself and let the poll hang in for a moment as you mount your presentation. Thank you to all who participated. I'll leave it for a moment. And meanwhile, I would urge all of us to stay in so we see whether we got the answers correctly. Dr. Mungoma will take us through. Dr. Mungoma, karibu sana.
Yeah, thank you, everybody. And again, good evening, everybody. Welcome to today's webinar from Counters to Counseling, Navigating Modern Contraceptives. It's such a pleasure again to be back here. and see a diverse group of pharmacists joining us, including those that have recently graduated, interns eager to grow in practice, our seasoned pharmacists that continue shaping the profession, and even those that are joining us for the first time. Continuous professional development is always at the heart of our profession. So as healthcare workers, we need to continue keeping up with what is evolving, expanding our knowledge, refreshing our skills, and just adapting to what is coming into pharmacy practice in Kenya, especially. So today's session, we just want to provide exactly that, a platform that can enhance our understanding about modern contraceptive options and just strengthen our role, as trusted healthcare providers, not necessarily just vendors who can counsel, educate, and empower clients in the field of family planning so that they can make informed choices. Yeah. And I hope that we can share in this platform. I'm grateful again for Bear, who supporting us in this. So I'll just quickly take us through this. So I'll just start by, again, providing this disclaimer. The views and information presented in the session are intended solely for educational, to support pharmacies in providing quality family planning and reproductive health services. Yeah. And you're all encouraged to refer to up-to-date national guidelines, product information, clinical references when making professional decisions. So presenter assumes no responsibility for any changes in recommendations, emerging data, and product updates related to contraception or management of heavy menstrual bleeding that may not be covered in this presentation. So what do we intend to cover? By the end, we should be able to describe some contraceptive options commonly handled in Kenya pharmacies, and then recognize, manage, appropriately refer clients with heavy menstrual bleeding without organic pathology, and be able to apply WHO, Kenya Ministry of Health job aids, importantly, again, screening, medical eligibility criteria, which is a very important tool, as well as counseling, which is a skill that sometimes lacks even in our formative stages, but very, very key in terms of service delivery and being an effective provider. Promoting self-care options, supporting clients to self-administer where appropriate, and describing this oral combined contraceptive pill that has estradiol valerate and dienogest, and then identifying, of course, training and upskilling pathways. So we'll just start again by reminding ourselves why pharmacies matter in family planning in Kenya. We have a high accessibility. We are located in communities. Pharmacies are usually convenient in terms of where they are, the hours. We now have 24-hour pharmacies, allowing clients, patients to be able to access us in terms of, in case of emergencies, in case of clarifications, and so on. Privacy and reduced stigma. Again, it's a place that is preferred by adolescents and also working adults. And some of these groups become and are increasingly becoming important. One, because the populations of adolescents are growing, their health needs are still unique. Evidence of pharmacies increasing access to short-acting methods and self-care options. And our role, again, in providing continuity of care, creating demand generation, and being able to report what we are doing, and having that public-private, again, partnership enhancement. So the scope of practice, Kenya MOH, Ministry of Health Family Planning Guidelines, National Training Package, supports pharmacies to provide information as well as selected methods. So they can provide short-acting methods, oral contraceptives, emergency contraceptives, barrier methods such as condoms for both males and females. And also when they are trained, then they can administer injectable contraceptives like DMPA, subcutaneous, as well as intramuscular. We are able also to access this tool that is known as the medical eligibility criteria. It is actually available online as well, but you'd need to be trained to effectively use it. And this is something that can allow pharmacies to make very, very informed decisions in critical times. And then national job aids that are able to screen for safety. So what do we commonly administer? Non-prescription, again, OTC, condoms, male and female, emergency contraceptives that would contain levonorgestrel, and barrier methods. We need to be well equipped, well versed, even those that we assume are methods that sort of like common sense, like barrier methods. It's important to be able to provide the right information so that clients are able to buy and use them appropriately and correctly. Prescription, combined oral contraceptives, POPs, progestin-only pills that would normally be used by breastfeeding mothers, and of course the injectables where people have been trained. A referral system is so important. All pharmacies, retail pharmacies especially, should have connections with facilities where clients requiring other forms of contraceptives, including implants, IUDs, intrauterine devices, sterilization, permanent methods, can be referred to. Counseling framework. The counseling should be client-centered and have a rights-based approach. Use of informed choice approach, listening, assessing needs, providing options, check understanding while engaging the client so that it's not a monologue. It's not a case of handing over or advising, because there's a clear difference between advising and counseling. Because with counseling, we're able to allow the patient, not the patient really, the client, to make an informed decision, think about what has been said, ask questions, and then take responsibility of the final decisions that they make. Agree on a method. Key communication skills, having open questions, reflective listening, neutral language, and privacy assurance. Accessing family planning methods sometimes can be intimidating. And this is something that maybe is cultural, but of course, with different segments in the society, this is something that can always be addressed so that as a service provider, you allow the client to come in comfortably and talk and access the best methods for them. Addressing myths, side effects, resupply plan, if they're going to come for pills for the first time, and then come the next month or the following cycle, so that there's a clear follow-up as well as documentation that can also trace adverse drug reactions or any other concerns that the client may be having. So the MECWIL, the medical eligibility criteria, we have the Kenya screening list. We need to rule out pregnancy when clients are coming to look for contraceptive methods. We need to also look out for contraindications that could be client specific. Do they have cardiovascular issues? Do they have things like migraine, smoking, age? And also, if they are taking other medications for other purposes, then the possibility of interactions, and which can either, even just reduce the effectiveness of some of these methods. So being able again to check the pregnancy status, chronic illness, breastfeeding status, desire for pregnancy is very, very important. And when in doubt, you should be able to refer maybe to a clinician or use a higher level facility. So this is just one of the job aids that I'm displaying here, which is usually very, very important. How to reasonably be sure that a client is not pregnant. And it's something that is accessible online. You can download it, or you can just have it on your phone, or wherever you feel convenient at your facility, and you're able to interrogate these two, as well as use it to appropriately guide clients so that they make informed decisions. Self-care and self-administration in contraception. Actions people take to maintain health. And I think it's one of these concepts that is, we are at a time when everybody needs to embrace this, both clients as well as healthcare providers, so that we can support each other in ensuring that everybody maintains a good level of health. Examples that contribute towards this is self-administration of DMPA-SC, self-care counseling, emergency contraception access, and menstrual care products. So for pharmacists, we should be able to train our clients for self-administration, and also ensure that they safe disposal of some of these maybe packaging that come with these methods, and also do a follow-up. So I'll just straight away go to this combination, estradiol valerate, dienogest. This is a combined oral contraceptive that comes as pills containing those two products, or those two active ingredients, that is designed to provide effective contraception and cycle control with improved tolerability. We'll have a colleague from Bayer to speak a little bit more around this, but it's important, again, just to understand the basics of how this works. With contraception, it is able to suppress ovulation through inhibition of these hormones, follicle-stimulating hormone and luteinizing hormone, and also increase cervical mucus viscosity, thereby impeding sperm motility that would be necessary to result in pregnancy. It also alters the receptivity of the endometrium, reducing implantation and thereby offering contraception. With heavy menstrual bleeding, non-organic, dienogest is able to stabilize the endometrium and reduce bleeding intensity, whereas the other component, estradiol, supports cycle regularity with lower metabolic impact that can be seen in other products. So this new product has 88% reduction in heavy menstrual bleeding. And the estrogen is identical to the body's own. So it's making it very, very unique and very, very effective and preferable, actually. So those are the two indications that are there. But we'll just talk about heavy menstrual bleeding because sometimes this is an area that pharmacies really need to be keen on. And 1/3 of women would switch their contraception if it reduced menstrual flow. It's so important, that message there. 1/3 of women switching their contraception if it reduced menstrual flow. Again here, heavy menstrual bleeding is a subtype of abnormal uterine bleeding and is defined by its impact on a woman's quality of life, so that it's not just sometimes what people would describe as spotting or irregular menses. So it's a subtype of abnormal uterine bleeding defined by its impact on a woman's quality of life. And we have a table there that describes the normal characteristics in terms of interval and the duration of bleeding that guides in identifying heavy menstrual bleeding. So traditionally defined, I'll just move past this slide. So some of the impacts of heavy menstrual bleeding on social lives and relationships that really require our ability to manage this and address clients who require products and services that can improve on this. Women with perceived above average menstrual flow also reported that a heavy period impacted, one, their ability to perform sport and fitness activities, type and color of clothes that they wear, as well as, importantly, relationships with partners. So this combined oral contraceptive is indicated for heavy menstrual bleeding. And it is very useful for women seeking a contraceptive that provides rapid and sustained relief from heavy bleeding. Rapid and sustained relief from heavy bleeding. And we have a reporting there of 88% reduction after 6 months of treatment. Reduced menstrual blood flow, blood loss with this combined oral contraceptive results in additional benefits physiologically, increasing hemoglobin, hematocrit, basically all the blood parameters improve. Quality of life, importantly, reducing menstrual blood loss, impacting on women's health-related quality of life. And this is quite positive. As pharmacists, it's important for us to be able to generate demand and provide quality service at the retail pharmacy. Having products at the pharmacy does not necessarily mean that people will walk in and even ask about those products. Creating a welcoming private counseling space, having youth-friendly hours, and also ensuring that as a pharmacist, as well as the staff that you have the right attitudes. Like I said earlier, cultural practices can have a very huge impact on how we deliver as healthcare providers. And we know ourselves individually what we carry, culturally and traditionally, and sometimes religiously. That could impact on how we provide services at the pharmacy level. Apologies for that. I think, having challenges with power. Having IEC materials can enable you as the provider to communicate without necessarily having to talk to the clients, and allowing them to engage with some of these materials, providing them at counters. Social media, the power of that is something that we can't even measure, as well as community engagement. As pharmacists, we should be able to participate in activities that are embedded in the community, so that we can talk about family planning options, we can talk about products that are there to address heavy menstrual bleeding in particular, and also just talk about ourselves as trusted healthcare providers who, beyond dispensing medications and sometimes being perceived as vendors, can actually provide services and refer appropriately where needed. So having brief health talks again is encouraged, and these can have a great impact on demand generation. I know that retail businesses are profit driven, but people just have to think outside the box and say that if we're able to invest creatively around demand generation, then holistically this can increase traffic to our retail pharmacies beyond specifically providing family planning services. So ensuring consistent supplies, having records kept, and having good commodity management, as well as reporting to the MOH where required. We're having more and more results coming through retail pharmacies that are able to report to the KHIS platform. And this is something that over the years to come will also impact on terms of what the country really needs and what the different segments in society, including adolescents, because adolescence still remains an area that guidelines as well as policies need to be finalized. Again, some of the other pharmacy accessible treatment options for heavy menstrual bleeding. And the guidelines are not, I would say they're not really there, but of course facilities, and if you're able to access online, some of the hospitals that we have, Kijabe Hospital has a few guidelines there for heavy menstrual bleeding that some of us can refer to. Tranexamic acid has been useful. Non-steroidal anti-inflammatory drugs such as ibuprofen have been useful in reducing bleeding and cramping, as well as combined oral contraceptives, which can regulate cycles and reduce blood loss. But importantly, again, it's important to ensure that contraindications are checked before dispensing these medications to those that have heavy menstrual bleeding. And the last one there requires referral for administration. So in summary, the combined oral contraceptive has the following features: easy to use. It's one pill a day. And we're going to have somebody else talk about some of the details there. Providing nearly 100% contraception, is able to reduce menstrual cramps, and provides positive reduction in menstrual migraine. It can positively affect sexual function and the quality of life. And this positivity that it impacts in the woman is so important. Provides up to 88% reduction in menstrual blood loss in 6 months of use. Is able to also address issues of acne and provide beneficial effects associated with oral contraceptives. We know that some of the benefits there also include reducing incidences of cancer. Yes. And these are some of the resources that I was able to access. And I would encourage you also just to quickly Google some of these. They're available online to be able to empower yourself and be able to engage your clients better in providing quality family planning services, and importantly, engaging these new combined oral contraceptive that is definitely doing much better as compared to some of the products that are there in the market. Thank you for listening to me, and that brings me to the end of my presentation. Back to you, Miles.
Thank you so much, Dr. Mungoma, for that insightful presentation. And this time, I'd like to welcome Ilse Engelbracht. I hope I got that correctly.
Thank you, Miles. That was perfect. Thank you.
Okay.
Okay. Good evening, everyone. As Dr. Michael said, I'm from Bayer Women's Health. I'm going to start sharing my screen, and I will take you through this new lady on the block in Kenya so that you can be introduced to her. Okay. I'm just going to put it into presentation mode. There we go. So first and foremost, with Bayer Women's Health, our vision is to support women from menarche to menopause. And as Dr. Michael alluded to, Clara is the newest lady
Sorry,
on the
Ilse,
block.
we don't see your screen.
You don't see my screen. Sorry.
Screen sharing.
Let me just stop from my side. Sorry. Share. And then can you see it now, Monica?
Yes, yes. Now we see your screen.
Sorry. And
There we go.
I'm going to start over. Is it better now, everyone?
All good.
Yes.
Thank you, Ilse.
Oh, thank you very much. I'm also going to introduce to everybody my team. So Tina Visser is our medical advisor, and Monica Kroll is our training manager from Bayer. So thank you very much, ladies, for my support. If you have any questions, everybody, please put it into the chat. These two ladies are so much equipped to answer the questions, and we would love you to have as much questions about this new lady in Kenya that is available to you all. Okay, so for me to start now is with Bayer Women's Health, our vision is to support women from menarche to menopause. So with Clara, you will see that Clara is taking the cue from nature. So as Dr. Michael alluded to, is that we have two indications for this combined oral contraception. That is then heavy menstrual bleeding and then also contraception. So there's an 88% reduction in heavy menstrual bleeding, and we have an estrogen that is identical to the body's own. So you will also see that this is a very unique combined oral contraceptive with a 26-2 regimen. So we'll get to that when I explain to you how the wallet of the pills is looking. Just to allude again to what is estradiol valerate and Dynagest. So specific properties of estradiol valerate is then the 2 milligram estradiol valerate compares to 4 to 20 microgram of ethanol estradiol. It's lower hepatic protein synthesis and therefore have a safer hormone profile, and it has a greater vaginal surface cell maturation versus the other older estrogens on the market. Then if we look at the progesterone that is Dynagest, it has a hepatic tolerability, no interactions with your hepatic transport proteins. It's got a higher free concentration, so it's 10% compared with other progestins, and it's directly inhibited of the ovarian estradiol production. Then if we look at the efficacy, we always look at two parts of any of our pharmacological agents or oral contraception. Is first we want to see what is the efficacy in contraception, and Dr. Michael did the heavy menstrual bleeding as well. So this is just to tell us the contraceptive failure rate in the pill index. I'm just going to read to you what the pill index is. This is the number of unintended pregnancies per 100 women taking the contraceptive for 1 year. So this is the index measuring how effective is a contraception. So Clara use was evaluated in a large prospective, controlled, non-interventional, long-term phase 4 cohort study among women in the US and in Europe. And there was more than 50,000 women in this study. So you will see that method failure then is around about 0.42, and Clara then user failure then was 0.79. So this will tell us that we have a highly effective contraceptive with Clara. I hope that explains it very well. Then also, if you look at contraceptive failure rates in real life, because you must remember there's two sides. If you have in a study, somebody will look and will give you the pill, and they will monitor what pills are taken. In real life, life happens. Sometimes we forget. You will see that Clara did very, very well compared to the other oral contraceptives. Its high efficacy was confirmed in younger women, less than 25. So the percentage of the women aged in this study was then between 18 and 35 years. Okay. Dr. Michael did the heavy menstrual bleeding just to see it is defined as excessive menstrual blood loss, which interferes with a woman's physical, social, emotional, and material quality of life. It can occur alone or in combination with other symptoms. So you can see that we have a traditional defined as more than 80 milliliters of blood loss per menstrual cycle. And then the common effects of heavy menstrual bleeding on quality of life is then your poor productivity and impaired function. Many of these ladies can't go to work, or if it's younger students, they can't go to university. It's got a negative impact on your relationship with your partner and your family. And then also a negative impact on self-esteem as well. Okay. This was also shown then in this study that we have the 88% reduction in menstrual blood loss after 6 months of treatment. Also very important, you will see that you will start your Clara, but you will only see the effects after 2, 3, 4, 5. The biggest effects is after 6 months when you have that control of your hormones then. So it's very important if you counsel that you have to counsel these patients that they have to use their Clara for at least 3 months, 6 months to see the full effect of this contraceptive. Okay, then this is just another product of ours that also is indicated for heavy menstrual bleeding, which is the intrauterine device, Mirena. And if you compare the Mirena that is used as the golden standard for treatment of heavy menstrual bleeding, you will see Clara is comparing very favorably with this device as well. Good. Okay. You can also see yet again It reduces menstrual blood loss with Clara, results in additional benefits. You can see that she's looking so much more happier. Her quality of life is improved, and then also a physiological improvement is in her hemoglobin, hematocrit, and your ferritin, which is your iron stores, that has been improved if you improve the heavy menstrual bleeding. Then we have to look at how safe this product is. So the first and foremost, we have to think about VTE risk as well. So if we look at women who are not pregnant and do not use a COC containing any estrogen, there is around about 4 per 10,000 women per year that will have a VTE. If you look at women using low-dose COC, it increases to 7 to 10 per 10,000 women per year. Women during pregnancy or postpartum, there is around about 20 to 30 VTEs in that women with VTEs per 10,000 women. So the increase for postpartum and pregnancy is so much higher than for a VTE. So this is just putting everything into perspective. What is our VTE risk? Okay, combined oral contraceptive use. Then also, this is just the INS score, looking at, again, venous thromboembolism, arterial thromboembolism, and then the risk of a serious cardiovascular events. It was found to be lower than other combined oral contraceptive drugs, and therefore Clara has a favorable safety profile with regards to VTEs when compared to other combined oral contraceptives. Then the benefits beyond contraception. We always talk about what else can a product give to you. So if we look at hormone withdrawal associated symptoms, and then also lighter scheduled bleeds, cycle control, and female sexual dysfunction is 4 of the extra benefits that was recorded with Clara. So hormone withdrawal associated symptoms is then those headaches and pelvic pain that some of our women experience every single month with their menses. These symptoms may lead to a reduced user satisfaction and quality of life, suboptimal adherence, and high discontinuation rates. So with Clara, because I told you the regimen is then 26-2, you have a shorter hormone-free interval. So it's only 2 placebo pills. So you can then expect that your patient will have less hormone withdrawal associated symptoms. So let's look at the effect on headaches and pelvic pain. As you will see from the baseline to cycle 6, both with Clara is then in the blue, and with the other combined oral contraceptives, you will see from the baseline to cycle 6 is the 6 month, you will have an enormous reduction then in your headaches and your pelvic pain for these patients. There's a lot of writing. I'm just going to go on to that. A considerably lighter scheduled bleeding is also one of the extra benefits that you get with Clara. Just to show you as well, again, the maximum intensity of a scheduled withdrawal bleeding in cycle 1 to 7. So each one of these is a cycle, and it will show you exactly where is the spotting, where is the light bleeding, where's the normal bleeding, and where is the heavy bleeding. And you will see with Clara, it increases as you go along in your cycle of treatments. Also good cycle control. Yet again, some of the patients will report that they get amenorrhea. 19.4% of patients will tell you that after a 6 cycle therapy or usage, they will have amenorrhea. It's between cycles 1 and 7. Okay. Female sexual dysfunction. So patients with female sexual dysfunction who switch to Clara experience similar levels of sexual desire and arousal compared to the androgenic combined oral contraceptives. So this is one of the effects that it's not an indication for treatment, but that you will see that improves over the course of where on cycle 6 if you use the Clara. A significant improvement in sexual enjoyment and desire, an improvement of desire, arousal, orgasm, enjoyment, and sexual activity, and a significant reduction in dyspareunia. So this is also then an extra benefit that goes beyond the contraception of Clara. If you look at the high satisfaction rates, 92% of women said that they're highly satisfied with Clara. 44% said that they have an improvement in physical wellness, and healing and emotional distress was 40.1% of these women. So this is the back shot. This is very unique to Clara. So this is a wallet. We call it the Clara wallet. So you actually unfold it and you will see on the inside, then you get your pack. If you have to start, you have to take out the sticker and start it then. Say for instance, if you start on a Wednesday, you take out the sticker and you stick it to your first date, and then you start. So remember, I told you that this is a very unique regimen. You will see that if you look at each pill, so the first 2 pills is only have your estradiol valerate 3 milligrams. Then from pill 3 to 7, you have 2 milligrams Dynagest and 2 milligram estradiol valerate. Then from pill 8 to 24, it's 2 milligram estradiol valerate, but 3 milligram Dynagest, and 25 and 26 is then only 1 milligram estradiol valerate and none of your progesterone, and then you have your 2 placebos. So this is a very unique way of a regimen to be used by an oral contraceptive. Very, very important thing also on the inside of the wallet, you will have the mispull rules of Clara. This is just a combination of a monophasic 21-7 with Clara, and you can go through it. The basic rules are still the same as with any combined oral contraceptive. 1 pill a day, no break in the intake. Mispull rules are always at hand. So if you open up the wallet, the mispull rules are there. And then monophasic COCs also have a multiphasic mispull rules. So you will see that they go less than 12 hours ago. Then you've got your instruction, where with Clara, you will see that they have the instruction, and then day 1 to 9 is a little different, 10 to 17, 18 to 24, 24 to 26, and 27 to 26 as well. So that is the ones that we just covered. Mostly only missed 1 pill more than 12 hours ago, then you have your instructions that you can use. Then just in summary, the benefiting more women beyond contraception with your unique 26 regimen with Dynagest. If you look at the benefits beyond contraception, you have shorter, lighter bleeding. It's an optimal cycle with Dynagest-induced high endometrial suppression. Then if you look at what the estradiol valerate is doing, it delivers identical estradiol to the woman's body, and it's got a positive safety profile. And then also it reduces hormone withdrawal associated symptoms because of the unique regimen. It's only got the 2 days of the hormone-free intervals, and it maintain then a stable estradiol levels. And it has a higher user satisfaction. 80% of young women who switch to Clara are satisfied or very satisfied. This is a unique yet simple once-a-day regimen which contributes to a high efficacy, added benefit that also appeal to our younger patients. Okay. Then this last slide, I'm just going to, because Bayer also have 3 other products in the market, this is just a pack shot image and then the product description. So the first and foremost is your Clara, your unique regimen. Then also Yasmin, the innovative pill that then have your ethanol estradiol and your 3 milligram drospirenone with 21 active pills. And then you have a 7-day break before you start the new ones. The indication is then an oral contraception with anti-mineralocorticoid and anti-androgenic effects, also beneficial for women who experience hormone-related fluid retention. And this is resulting in symptoms for women with acne and seborrhea. So that is, you can use that. Then Yasmin. Then the microgynon, oldie but a very goodie, is also still on your market. And that is for your oral contraceptive, 21 active pills. And then Primalot N is a multiple indications then for your dysfunctional uterine bleeding, primary and secondary amenorrhea, premenstrual syndrome, and if you want to time your menstruation. So all of these then is on the market. And that is my last slide. Thank you very much for your attention. And I hope that there is some questions.
Thank you so much, Elsie, for that wonderful presentation. Maybe as we wait for some questions, we the post tests. I can share the post poll. Esteemed members, on your screen you should be able to see post poll questions following what we have learned today. I would like to encourage each and every one of you to engage with it. For those who might not be able to see that on the screen directly, I'll be sharing a QR code which can take you to where the poll is. So just a moment, you should see a QR code on your screen. And yes, there it is. So far, I have a few responses coming in. Meanwhile, Ilse, I have a question from Dr. Kibet Eric, who is, I don't know whether it's you who would take this or Velma, asking about the cost of Lyra.
I saw it. Velma, I think you are the most, because I'm from South Africa, so Velma is in Kenya. So please, Velma, if you can just clarify on the cost of Clara.
All right, thank you. So let me turn. So the cost to the patient is about slightly less than 2,000 shillings per month. That's from what we have found from the retail outlets. But you can get from around 1,500. I think that's the lowest we have seen. Yeah.
Okay, thank you, Velma. I have another question.
So with 1,500 per month, we encourage the patients to, no, the clients, not patients, to get all those benefits.
Okay, Velma, I'm not sure that it's my internet, but you're breaking quite a bit. Meanwhile, I'll say there's a question on the chat. What are the benefits of Clyra over Yasmin?
Okay, so if you look at the benefits versus Yasmin, and Tina, you are more than welcome to to skip in here. So first and foremost, the benefits are the registration. So we've got the extra registration for heavy menstrual bleeding. And then also the extras, the benefits that I said, the beyond the contraception, that you can treat the HWAS, and then also some of the other negatives that you experienced during menstruation. Tina?
Yeah, Ilse, I do agree. I think the most important thing is that you've got the two indications, so it's not just contraception. Second of all is the hormone withdrawal associated symptoms. So for those patients that are currently taking Yasmin, and in that hormone-free 7-day period, they are complaining to you of migraine-like headaches or pelvic pain. Those patients are then ideal to switch to something like Clyra because because of the shortened hormone-free interval, only the 2 days of placebo, there is almost no time to develop these symptoms. It is very novel in the fact that it's the only combined oral contraceptive that's got this 26-2 regimen. Then also what we have mentioned, obviously because it does reduces the heavy menstrual bleeding or your menstrual blood loss considerably, you've got the potential upside on your iron stores. So that is the second or a second benefit. Then also your, and together with that, because we know heavy menstrual bleeding is usually associated with dysmenorrhea, you will also have relief of dysmenorrhea as well, because the Dynogest is extremely potent product that works on extremely potent progesterone that works on the endometrium. It really suppresses that endometrium to a large extent, much more than what some of your other progestogens will do. So also just keeping in mind, Dynogest is the progestogen that we have got in our endometriosis treatment, Vizan. So, you know, it's got a really potent effect on the endometrium. So I think that therefore also, apart from reducing heavy menstrual bleeding, you've also got the reduction in dysmenorrhea. And I think the other thing that for me personally is a big plus point is also your the relief of your COC-related female sexual dysfunction. So a lot of patients that are on some of your other combined oral contraceptive will tell you that they have got a decrease in their libido. And we have seen that because they are on the pill. So for those patients that do complain to you that they are currently on some other combined oral contraceptive pill, their libido is very low. It's obviously got a huge impact on their relationship. Try and switch them to Clyra because they will have an improvement in this, what we call combined oral contraceptive related female sexual dysfunction. I think those for me are the most important benefits that you do have over Clyra. Over Yasmin. Very novel product that really can change women's lives considerably.
Thank you, Tina.
Thank you so much, Tina. Thank you so much. That was very detailed. Hope that answers your questions, Dr. Angela Kariuki. As just information from Tina.
Yeah, Miles, I see there's from Lindsay Olima, comment on a case of misspill and change from other methods to COC. Any special instructions? I think I'm going to give that to Tina as well.
Yeah, no problem. So you kind of need to follow the rules, the misspill rules, because it depends on where in your cycle or where the woman where in the cycle the woman has missed the pill. That will then tell her whether she needs to start a new pack, or if she can just, continue taking a pill. For instance, in the middle of the pack, you can just literally take 2 pills at once if needs be. So it's the same then with the most other contraceptives. You should not be later than 12 hours. But what is convenient with this missed pill rules is that it's not like it's printed separate in a package insert that is separate from the wallet. The wallet literally folds out into 3 pieces, and in the middle section, the missed pill rules are printed. So the women don't need to now go Google or phone the pharmacy or whatever the case may be. She can literally just check the missed pill rules on the pack. So that makes your life a lot easier. That's the first thing. What is it? What was the other part of the question?
If you change from one
okay.
method
So
to
it
another.
literally, there is very specific instructions in a package insert. But for instance, depending on what method she previously have used, that depends on how she will start. If she hasn't had any hasn't been on any hormonal contraceptive, she will start on the first day of her menses. And remember, we've got the stickers. That will be day 1. So say, for instance, the menstruation starts on the Wednesday. You will take the sticker that starts with Wednesday, Thursday, Friday, Saturday. You'll peel that part off, put it at the top. Wednesday will then be pill 1. So that's the basics. Then obviously depending on which method she switches from, say for instance she switches from another pill, she can have her withdrawal bleed and then start with a new pack, on the first day of that bleed. So it's just depending on which method she has, she was previously been using, but it is specified in the package insert. Not much more different than if she's, switching, to a contraceptive pill, like for instance, Yasmin. So it's very much the same, but it is very clearly stipulated.
Tina, I have a question on that as well. If
Yeah.
you want to skip your menstruation,
No.
you go.
Very good question, Ilse. Yes, because this is not a monophasic pill like Yasmin. I want to say, number one, a woman will experience lighter, shorter bleeds, and we saw that almost 19% of them will report amenorrhea. If that is not enough for this woman, skipping pills or skipping the placebos and just going onto an active is not going to work. It's not like with Yasmin that you just continue with your actives. You're not having your withdrawal bleed. Doesn't work like that. You technically need to, the last 4 tablets in the pack, you need to skip, as well as the whole top 7 pills as well. So in total, you will throw away 11 tablets in a pack. So again, if a woman regularly skips a period, or if the amenorrhea or the bleed that she is already having on Clara is not sufficient for her, if she requires higher amenorrhea, or if she wants to tricycle, no, a monophasic pill will then be better for her. This is not going to be the product for her. So I think one of the counseling questions that is very important to ask a patient is, what do you want to happen to your period? Do you want it to be the same? Do you want it to be be much less? Also not that heavy. And that was going to also depend which method you're going to advise her on. But please, if a woman wants to skip a period on Clara, or does it on a regular basis, no, this is not the product. She's going to go through 2 packs of Clara in a month, and that doesn't make it cost effective.
No, it's not.
I saw a question on adverse events. Adverse events, like I said, the most serious adverse events, obviously, like Ilse discussed, what is VTEs, because we know that is that is the most serious. But it is kind of the same as, there's nothing special to Clara. It's very comparable to other combined oral contraceptives. So, you know, it's the hormonal things. It's headache, it is, you know, breast tenderness, that type of thing. So it's kind of the same as with other combined oral contraceptives, but yes, it does differ when it comes to things like effect on libido and then hormone withdrawal associated symptoms. Just need to very important to, like Ilse said, we have got the real world evidence with regards to VTEs, and that it is at a lower risk than what some of your other combined oral contraceptives is.
Tina,
maybe.
yeah, sorry, Miles, there's just, what is the best time to switch to this product from another product? So if you are having your cycle, if your cycle is starting your first day of menstruation, am I correct?
Yeah, I want to say finish whatever product
Yes.
you are on, you know, or for instance, say you're on an implant, the day that it is removed, you can start with this product. So don't yeah, it really
Middle
just
of the month.
depends. Yeah, but like I said, it depends on the current method that you're using. That's what's going to determine how you're going to start this product. So just address or look at the SMPC or your package insert for that.
Yeah.
Miles?
Yeah,
Michael, you also wanted to say something, sorry.
Yeah, thank you. I think I know I really like the questions and the answers. Just to again reiterate what you're saying there, that when it comes to method switch, of course, I mean, even as a country, we have guidelines, and they are really in line with what you're saying there. And it's all dependent on what method they were on, and importantly again is the counseling. It's the counseling of the client, so that we know for sure that they were using the other method consistently and correctly, and determination that she is not pregnant at the point where they want to switch. And depending on the method, if, for example, if it was an injectable, then they can start combined oral contraceptives when the next injection is normally due. But as you're saying, if it was a device, an intrauterine, so it can be started within 5 days of menstrual bleeding. And yeah, so I think it goes beyond just quickly switching. I think counseling really plays an important role here. Thank you.
Dr. Michael, I think there was another question. I just don't want to miss it. What is the category risk for lactation, including microgynon? Maybe you and Tina, I'm not sure.
I probably didn't get the question correctly, but obviously, if you have a lactating mother who wishes to get a contraception, there are those that are recommended, POPs, which is progestin-only pills, because with a combined oral contraceptive, there is a risk of reduction of milk production. So it's actually contraindicated. So it's the progestin only that is recommended. It has a low dose of progestin hormone. And of course, it comes with very specific guidelines, one of them being that the pill has to be taken at the same time every day. Yeah. And again, the client has to be counseled just to ensure that they're not taking any other medications that would reduce the effectiveness of that pill. So that is there, and it works very well.
I love that question, Tina. Did you see in the
from Laura about any contraceptives for men? At this point in time, Bayer does not have anything for men. It was recently on the 26th of September, World Contraception Day, and I attended the international webinar from the European Society for Contraception. And they had several methods that's in testing for men. So very exciting that, you know, it's not just the woman that's left with the baby, but that decision is actually, that burden is then carried almost equal by the partners as well. So let us watch this space, but unfortunately, currently not. And also, you know, not in the near future, but definitely there is some stuff on the horizon, and that looks super exciting.
Okay.
So how long does it take for Clara to provide pregnancy protection if started on any other day? Don't start it on, again, depending on which method you were on, that's going to depend on contraceptive efficacy, because like with any other pill, actually not with any other pill, if you've got the miss pill rule normally says, you know, if you've missed a pill, you need to take additional contraception for 7 days, because you because of Clara having some pills that do not have any progestogen, and we have, you know, they've got only estrogen in it, and because progestogen is your main contraceptive hormone, that's why we've got emergency contraceptive that only contains levonorgestrel, because that is what gives you ovulation suppression. So for the miss pill rules, you need to have 9 days of uninterrupted contraceptive or Clara use in order to ensure that, you know, you maintain contraceptive efficacy. So that is also actually, now that I remember it, Ilse, we must actually add that to our miss pill rules, or just highlight the fact that, you know, it's 9 days compared to other contraceptives that's 7 days. But the reason for that is because of those pills that only contain estrogen. Yeah.
Yeah. So in our setting, they usually call it a backup method.
That's it, a backup method, yeah.
So you have to use a backup method for another 7 to 9 days. Yeah.
Yes.
I just want to check the Q&A. No extra questions there, Tina, and I do not see anything. Miles, do you see anything else?
On my end, I also think we have exhausted them. Dr. Bungoma, maybe do you want to go through the post-poll questions before I take it down quickly as we conclude?
You're muted, Dr. Michael.
Yeah, sorry. I was just wondering whether they displayed the 6 questions so that we can go through them. But no problem. I can just go through them and say, so which contraceptive method can trained pharmacists in Kenya legally administer? Is DMPA SC. That's a subcutaneous. Okay, so they're all mixed up there.
Can you let me
Yeah,
try
now
and
I
see if
can.
I can project. You can see them?
Yeah, I can see them. Yeah, so it's the DMPA. Now I can see them. They were not visible earlier. So it's the DMPA SC plus COX, and the DMPA SC importantly is for the trained pharmacists. So that's good. At least we have 88% of the correct answers for question 1. And then for the second question, which of the following best defines self-care in contraception? Again, importantly, I think they were paying very good attention, individuals managing aspects of their health and allowing people really just to take responsibility, including self-administration of methods. 3, which counseling skill enhances client understanding and trust during contraceptive counseling. Yes, the correct answer is reflective listening and open-ended questions. These allows clients to really connect with you as the healthcare provider, and giving open-ended questions also allow them to explore their options and the ideas in the mind. It also then allows you as the provider to understand the client much better so that you can discuss the methods. Which statement best describes the mechanism of action of estradiol? Suppressing ovulation by inhibiting gonadotropin is what people have said, and that is the correct answer. So it thickens the cervical mucus, inhibiting again transport of sperm to the egg. And number 5, in women with heavy menstrual bleeding without organic pathology, which is a key therapeutic benefit of Dienogest in the combination pill. Yes, it stabilizes the endometrium and reduces excessive bleeding. And it's good that was captured very well, 91%, because it came clearly in one of the slides. So it's just a representation of how keen people are listening. Which of the following patients would benefit most from an estradiol? Woman with heavy menstrual bleeding and no uterine fibroids and desires contraception. Yeah, so I think we've clearly experienced some learning here, and I think everybody should be proud of themselves. We now have a new understanding of this product, this combined oral contraceptive, and hopefully beyond dispensing this product, we can also educate clients about it and educate our peers, and even just gather more information around this product so that we remain empowered. Thank you very much.
Thank you so much, Dr. And thank you for the insights. Thank you, Ilse, Tina, and Monica. I'm not sure, is it possible for Monica to just say a word as we close from the Bayer team so that yes, we can hear her voice? Maybe just a few closing remarks.
Thank you for the opportunity, Dr. Miles. It's so wonderful to be with all of you. We're so impressed that so many of you joined this evening. And we hope that you're really empowered now to be able to really recommend and counsel the patients with their specific needs in mind and really individualize that and really give them the opportunity to now level up with whatever they're battling with. You will be able to give them an answer from Bayer in terms of our women's health. And it is part of our vision to reach as many women as possible across the globe, and specifically in Africa, as you know, to have the option of contraception. And we thank you for your time, and we hope that we get to hear from you all soon. And if you have any questions, please direct them to our people on the ground, with Velma and Harun and the team. And yeah, all the best, everybody. Thanks. Bye from all of us in South Africa.
Thank you so much, Monica. Thank you. As we come close to this evening session, I'd like to thank everyone on behalf of the Pharmaceutical Society of Kenya, taking your time to join us and for all the active engagement throughout the discussion. Special appreciation to our speaker, Dr. Mungoma, to our partners, Bayer. Thank you again for your continued collaboration and support in advancing pharmacy-led reproductive healthcare. And to all members present, maybe just a quick reminder that this event will be listed on the PPP portal and you will be notified for you to subscribe. Just a small announcement. We are going on with the pain management series, this pain awareness week with Helion. You are encouraged to attend, and if you encounter any challenges, WhatsApp us and we shall be able to assist you. Given that, thank you all once again for joining us. Stay safe and have a wonderful evening ahead. Thank you. Bye and good night.